Hi, and welcome to the End of Life Journey and Beyond, the Sands of Time. My name is Lisa Strahs-Lorenc, and I'm a bereavement specialist. Good to see you, Susan. Always good to see you today.
Wonderful to see you, Lisa. Thank you very much. I'm Susan Capurso, end of life doula and legacy creator. And in today's video, we're talking about something that's just so important for everybody. With millions of seniors now and baby boomers in our world, that more than we've ever had before. Okay, this is an important note, and we don't have all the resources available that they need at this time in their lives. However, we're getting there. We're getting there. So Lisa and I, between seniors themselves and caregivers, right? We need access to resources. Where do we go? Who do we call? People, especially at home, don't have a lot of this information. Heck, we don't even have the yellow pages anymore. And believe it or not, a lot of people are not really computer savvy. Okay. But it's in hopes that our video today will be heard by people that will need this information or know people that might need this information. But what we do ask is that you sit down with a pad and a pen next to you, because you can always go back and to the beginning of the video, but Lisa and I will ramble off quite a few resources that can be really important in your world.
Yes,
So
yes,
thank you for joining us today.
sure. I want to start with the personal because I always like starting that way. I was a caregiver, 15 months as my husband had pancreatic cancer. And number one, I really had to learn about the disease. And then number two, I was not only his advocate, but I took care of everything. He was just trying to live, and I was trying to make sure that his needs were being met. Very difficult, very challenging, feeling very alone, very overwhelmed. The first thing I did, by the way, and I want to mention this, is I joined a caregiver support group. And that's for some people, not for everybody. But for me, I wanted to be around other people who understood what it was like to go through cancer care. I went through a cancer care group, and all of us were taking care of someone who had cancer. So we had our anger, we had our fears, we had all the other feelings that we all shared. And it was okay because it was in a very safe space to share that. So
How
that is something.
valuable? How valuable is that, Lisa?
Yes, it is. It is. It is. Especially feeling overwhelmed. And by the way, my mom too. I had a mom in the hospital for 7 months, and I had to be her advocate as well. And even though I wasn't taking care of her at home, I had to figure out how to make sure that she was getting good care in that hospital. And there were issues. There were many issues that came up, and seeking out
There
the
always are.
hospital's patient advocate, seeking out the different doctors, getting second opinions, third opinions. I mean, I could not get her out of that hospital for 7 months. It was one thing after the other. So I know you
Lisa,
understand some
how
of that.
did you find, what avenue did you take to find that support group that you were part of?
So I immediately went into cancer care, and a cancer care support group came up as I Googled it. But you can call up American Cancer Society. You can call up whatever disease, if it's a disease. Alzheimer's Association has many resources, leukemia, lymphoma. I mean, you take the person's disease. I know somebody, my friend has Huntington's, which is a very specific disease, different from ALS, different from Hodgkin's, different from many. And she is also a member of a group so that she hears what other people are doing and going through. So you can always do it that way. Though
Hospitals as well.
hospitals as
Hospitals
well.
can direct you in the right way.
Yes.
Um, but also, you know, Googling the particular ailment, I could, illness, I can see how powerful that can be because they're targeted and they're specific to that disease.
Right, right.
So,
Our friends were members of a lung cancer support group.
mhm.
So all of this at least makes you feel like you're not alone in that particular disease. Now I know you
Yeah,
went through somebody your husband in the hospital as well for a long time.
yeah. Well, with the hospital visit with him, it was 55 days in the hospital of not going home. They allowed me to sleep there with him. And it was all in the ICU. Uh, but little things arise, just like you said. right? The little things that come up that I felt the need to be there as his advocate to be able to speak for him. He was intubated almost that whole time, and things were happening starting in the first few days. So in his particular case, he was 6'8" and did not fit in the bed
Mm.
that he was put in.
Wow.
And to my amazement, I thought, wow, there are athletes, he was 6'8". There were athletes who were that big and needed hospital visits. Okay, you mean to tell me that there's no bed in this entire hospital
Wow.
that has a bed big enough? And everybody just said, oh, well, we'll see what we can do. We'll see what we can do. Well, there has to be some kind of resource that somebody can help me to get a bed here because they're cranking the blood thinners so he doesn't get a blood clot in his legs, but both of his legs were falling off the end of the bed, off
Wow.
the side. So the solution was to put a table at the end of the bed with a couple blankets on it and have his feet up on the table. Well, you know how comfortable it is to stay in that position. I don't care if you're intubated and, or what. Your body is going to move around. So every time I turned around, his leg was like this. So why are we giving him the blood thinners, right? To try and avoid these clots. The nicest little nurse, and I didn't know this at the time. These are all things I've learned over the years. She came up and she whispered to me, go downstairs on the main level and go to patient advocacy.
Yep.
Right?
Yep.
So when you don't know, you don't know.
Right.
And what a team. And the director of this patient advocacy council, I'm still very close with today. I'm on 2 councils with her at the hospital now to help make some changes in their policies. But the minute I went down there, the minute she grabbed my hand and she said, he will be in a larger bed. I'll get it for you come heck or high water,
Yes.
right?
Yes.
And within less than 48 hours, I would say about 30 hours, um, she had a bed come from New York City.
Wow.
They transferred it out to the hospital out east here on Long Island so it would fit my husband.
Wow.
So we're talking about resources
We
today.
are. We
She
are.
was my resource and patient advocacy department in any hospital or facility. They're there and they're there to help. When you
Yes.
don't know about it, though, you can't
Yes.
reach out for them.
That's right.
So,
And lesson learned, speaking up, because we are the advocates of our loved ones. And it's not easy, but you do need to speak up and make sure that you're getting the benefits or whatever services or resources that are available. And sometimes you don't know, so you got to ask.
and we
So,
don't remember everything. So
right.
this was important for me
Yeah.
as being a first time advocate now for my husband. I kept a notebook. You keep a notebook and you write down anything, big, small, little things. When you're spending time there, you have plenty of time to write. Write these things down. I don't need it now. It's in the other room in a box somewhere, but I did go back and needed to refer to a few different things when they would
Yes.
tell me one thing and I said, well, no,
Mhm.
so you need to be that advocate. We'll have a whole
Yes.
video on
Yes.
patient advocacy
Yes.
if we
Great
haven't
suggestion.
already.
Great
I'm not
suggestion.
sure. So today,
I
again, it's about the resources.
Yeah, I looked up Family Caregiver Alliance and they had some really good suggestions about resources at home,
Well,
especially
what's
when you're
that
caring.
website, Lisa? What
So,
that website?
I don't think I took down. Just look up Family Caregiver Alliance. Later on, I'll just give everybody URLs. Okay,
Oh,
for
well,
everything.
you can
I'm gonna
attach
do.
them to
I'm gonna do
the
all that.
video.
Yeah,
That would be
I'll attach them.
wonderful.
I'll
That
attach
would be
them all.
wonderful.
There's a lot of resources. But here's the thing, you got to start out with figuring out what the person needs. I mean, is it, bathing, dressing, transportation, food? Is it medical care? Is it legal? There's a lot of things here that encompass community care options available to, us and to our loved ones. So you got to figure out first the needs. That's what you have to start with, which I really liked because they actually have holding a family meeting where you discuss different aspects of what you need. So, for instance, what type of help does my loved one need? to live independently or to do, to whatever, to live in a good place. What types of help maybe in the future? Who in the family? You look at the family, who can take care of different things, or what kinds of arrangements need to be made? How much money is available to pay for outside resources? Will insurance cover any of the services? What days and times do I maybe need help? What kind of assistance do I need myself as a caregiver? Do I have a job that will affect the amount of care I can provide? I mean, when my mom was in the hospital, I had a really flexible job, and I was working basically from home at a time when people didn't, and I was going back and forth to the hospital every day. And I would type on my laptop during that time. I was really lucky that I had a really flexible job. And
You know, people don't realize, though, the amount of resources out there. We've had a few of them on our videos.
yes,
For instance, 101 mobility, right?
yes,
And she's only in the tri-state area, I believe. But there are resources if for your parent or loved one who wants to stay home and age in place.
yes,
Okay, but you want to have the house assessed, you want to make it safe, and that's one of the jobs that 101 mobility does. They come into your home, they say oops, 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 and oops, and oops.
yes,
They
yes,
see what
yes,
you need to have fixed, repaired, replaced, or whatever.
yes,
Okay, you need help getting up the stairs. People can age in place. They have the little
yes,
elevators and
yes.
go
Stairs.
back and watch that video if that's something you need.
Yes,
But like Lisa said, you got to figure out the different areas that may come into play and then break them down and say, okay, so where are our local resources that can help me do some of this?
right. There's also, and I will mention, we did have Mark Berlin, who specialized in disabilities and also seniors, and he's a patient advocate. So he's an independent patient advocate who assesses as well. So he will help assess with the family what the needs are. Somebody like that is also an example. But I think what's really important is that you figure out the overall situation. For instance, they mentioned informal care. So are there friends? Are there relatives? Are there religious organizations that maybe can help and share in the responsibilities of caregiving in general? It's what they call an informal support network. And that's important to figure out, maybe there are friends or relatives who would be glad, you just didn't know that you should ask them. You're available one time a week or twice a week or whatever, or maybe they'll do a certain thing and that's their particular job. So that's really
Right.
important because that really helps with the overall care.
I'm seeing
Um,
companion care agencies
yes,
now popping up all over the place.
yes,
Okay, so if they're background checked and vetted, you ask these questions, but you can call somebody and it doesn't mean you have to hire them. You
yes,
figure out how the payment works. Is it covered by insurance? Is it not? How many days a week? And you meet with the person because you want to know, like, and trust them, before
yes,
you hire somebody. So, but that's an added resource that's out there. I mentioned to Lisa at the beginning for family caregivers. And there's about 40 million Americans, just in America, family caregivers right now.
wow, wow,
And some of the main websites you can go to offer such valuable, valuable information. I subscribe to AARP, okay?
yep.
And to me, that is one of the best websites in the world. I should be their advocate because I can really talk up a storm when it comes to the valuable information that they offer. The topics you want to know about, the clarity of the writing in the
Yes.
articles. And they offer several articles in each month that you get their newsletter. So if you haven't yet, go in and sign up and be a member of
$16, I think, a year. I think it's
it's
$16.
something ridiculous like
It is.
that.
Yes.
And you get
Yes.
their monthly newsletter with such a plethora of valuable information.
Yes.
So that I would always recommend that.
Yes. I want to mention transportation services because the Americans for Disabilities Act. There's all kinds of different transportation. I remember when my mom needed help, there was, and I forgot the name of it here in Nassau County, but there's a certain bus, Able. Able Bus. That's right. And they used to take her to her appointments and stuff because she lived alone. She lived in an apartment. So, there are transportation services that will get you here and there. Many of them are private, not for profit, public organizations, usually free. I mean, she didn't pay for it. So that's something
Yeah, depending
that's
where
really
you are.
important.
In some areas, there's
Yes.
more transportation services. In
Yes.
other areas, there are not. So
Yes.
really, again, doing some research about that. We at first, when we did this video, Lisa and I we wanted to be more specific and give you the exact resources to call on Long Island because this is where we are and in New York. And our thoughts are that we know people who listen in from other areas, so that wouldn't be of use to them. So we're making it more generic
Yes.
and as far as where you can look and who you can contact
Yes.
for certain things.
Yes. Yes. There's nutrition programs. We all know Meals for Wheels. And so that's also a great program. Sorry, Meals on Wheels. Really great programs offered in most communities. My friends get it, and they're just senior citizens, but they're eligible for it. And again,
Yeah,
you need to know eligibility. They're all home delivered meals, and they get it once a week, I believe. And it's not only a friendly visit, but it's also a quick safety check, for loved ones. So
yeah,
that's something important.
yeah.
Yeah.
They now have also, and I'll try and remember it by the time if I have it written down here on some of my papers. There's a couple names, couple different organizations do it, and they do it for communication with seniors. So they will call once a week. They keep you
Nice.
on a list, and they call at a certain time every week, certain day, and check in with you. And
Nice.
that's a really nice service to have for one of your loved ones. I know with my own aunt, she just looks forward to that call and speaking with that girl. The same girl's been calling for a while,
Nice.
and she kind of built a little relationship with her over the phone, and she lives in a completely different state. But she won't answer the phone for anybody else on
Yes.
Saturday mornings because that's when this girl will call her. So, and she looks forward to it. So that's something nice. It's a place for a senior to really vent and talk about things when they don't want to do that with their own family members,
Yes.
right?
Yes. Which I should mention adult daycare. They can go to a place to socialize and enjoy some peer support, receive some health and social services, and friendly. A place that they feel that they can, socialize and have a little fun. So
Well,
there's
that's
adult daycare.
instead of the adult daycare for that, really the senior centers offer that.
Yes.
The
Yes.
senior centers. So they're
Yes.
usually in every community and they offer lots of different programs, lots of things to do, lots of field trips that they take, lots of
Yes.
activities,
Yes.
right? So it's important to also find your local senior center in your community and find out what they have,
Yes.
write them and what I'm sorry, not write them, email them, give them a call, go down and take a look, and see what kind of services. Finding these resources might take a little bit of work at first. Be proactive, do your research because you can find something that you least expected, right? Like, oh, I've passed that place a thousand
Yes.
times. What is that?
Yes.
And you might be surprised when you walk in the door about the whole gamut of resources that are now available to you.
Yes. Yes. And of course, we'll mention hospice care. Hospice care is available throughout the United States. And it's, special services to improve the quality of life for terminally ill persons. They were amazing in the last week of my husband's life. They sent in nutritionists, they sent in nurses, they sent in psychologists, they sent in, I mean, all kinds of helping
You
people.
have a team of
Amazing.
five, and it is amazing. I'm actually on one of those teams. I'm a hospice volunteer here on
Ah,
Long Island. So,
great
and
work.
we if you want to learn a little bit more about hospice, we do have a video in our library about hospice and what it's all about. And that was a wonderful video that you'll
Yes.
be able to learn more information. So find your local hospice and
Yes.
see what kind of things they could help if your loved one is nearing end of life.
Yes.
There are There are a few different sites here that I just wanted to mention real quick. One is the Administration of Aging, and you can find that at www.acl.gov. Okay, and they offer a variety, lots of different programs for people who want to live independently, disability resources, aging resources. Uh, they support many, many programs. Agingcare.com, that's another one. Uh, they offer a large variety of caregiving topics, many, and to help you find care, different types of care, especially if you're a caregiver. And other people share their experiences and questions on that website as well. There's a caregiveraction.org. Okay. There's a caring.com. Lots of articles, resources, directories on healthcare and elder care, law, finance, housing. These websites are built specifically to offer you all these kinds of resources. And you can't say that if you're listening to this, you're not computer savvy. Maybe the person you're looking for the resources, maybe they're not, but you are because you're listening to this today.
Yes,
So
yes.
check out some of these different kinds of health in aging, healthinaging.org, lots of helpinghands.com, caregiving.org, caregiverslibrary.org. That one sounds really interesting. They go over care facilities, emotional issues, money matters, end of life issues, long-term care.acl.gov, National Council on Aging, ncoa.org. National Aging in Place Council is a council that I'm part of, but that's nationally. So you can find a local chapter near you for resources. Nextavenue.org. Lots more resources on there. You know, the lists are just unlimited. So like Lisa said, we will make a list for you and add that to this video
Yeah.
after it's
Yeah, and
posted.
I have more too. But before I add them, I think I want to mention that you're not alone. I think we all have to figure out who else can either make calls for us or help us. You know, it's hard to ask for help, but at this time, you're going through a very difficult time being a caregiver. And so asking people, they don't know what to do sometimes. And just saying to somebody, if you could just make this one call, find out, what they have or what they have available or what other options do I have, that would be really helpful. And that also helps other people feel like they're doing something for you. So,
Yeah.
because it is
And
overwhelming.
sometimes and sometimes you are overwhelmed and drained a lot of the times. And sometimes you might expect people to come and knock on your door or to call you with these resources and information. And I most times it doesn't work that way.
Yeah.
It doesn't work that way. It really takes you to be the smart one and to be that resource, that liaison, to do the investigation and research. And again, it's a pain in the neck, yeah. But once you do, and you can find a handful of resources that you didn't have before, oh my gosh, it'll make
Yes.
life so much easier and a
Yes.
pleasure to have people helping along the way.
Yes. I'm going to mention the resources that I found over here. And again, we'll list them, when we post this. But under the Family Caregiver Alliance is the National Center on Caregiving, which is great. And the website is just, I guess it's the same one as you, caregiver.org. I guess that's the same one, right? Okay.
I'm not sure
Then
if
there's
that's what
the
one I mentioned.
Aging Life Association. It's aginglifecare.org. There's Elder Care Locator, eldercare.acl.gov. There's, of course, Medicare and Medicaid because you want to check up on what's going on. There's Meals on Wheels. Then there's the National Adult Services Association, which is nadsa.org. There's National Hospice and Palliative Care Organization, nphpco.org. There's the National Volunteer Caregiving Network. That's nvcnetwork.org/WP, and Visiting Nurses Association, VNAA.org. What I really like about this is that they also have books that they're recommending. There's a caregiver help book, Powerful Tools for Caregiving. There's the 36-hour day, a family care guide for caring for people with Alzheimer's disease or related dementia illness. There's the complete elder care planner, revised and updated version, where to start, questions to ask. So, there's a lot of resources out here. And again, it's easy to be overwhelmed because you're trying to make sure that your loved one or your friend is being cared for. So you are overwhelmed, but there are a lot of things out there for people to be able to look for and be guided by. And there's also professional organizations that also help. There's what they call management. I guess part of it is called a care management services,
That's what
and
I'm
that's
just looking at.
professional
And
care managers.
I've been meeting a lot of care managers along the way too, and they're
Yes,
wonderful because they can help you make your full circle and
right,
everything you.
right. Most of them are social
There's,
workers. Yeah.
there's a website here. It's the Aging Life Care Association, but it's called it's at www.caremanager.org. Is that the one that you see?
They
Um,
didn't give
okay, the website.
yeah,
And here
yeah,
you
they give
can
a
help
website.
find an aging life care expert. Um, you can locate professionals in your area, and it
Right.
includes more than 2,000 social workers, nurses, gerontologists, and other related professionals to help you manage your full care. So that's a nice thing to be aware of as well.
Yeah. In general, there's some really good suggestions. Making sure that you're prepared when you make your call. So, like you said, you write down, make sure you have physician's information, diagnostic information, insurance information, make sure everything is in one place. And when you're dealing with agencies, don't be intimidated, be assertive, be specific about the needs. By the way, they say mornings are the best time to call, to make phone calls. That's what they say here. And
Really?
don't hang up until you understand the follow-up. Okay. Make sure there's all kinds of follow-ups that you can do. You might be on a waiting list, so make sure you follow up if that's the case. Also, if there's a charge, you ask for a rate sheet. There's a lot of free online services. So you want to be aware of that. Again, don't hesitate to ask for help. The community agencies are there to provide, individuals for help and services.
There's
Um,
also,
yeah.
the medical alerts, the little
Oh
medical
gosh. Yes.
gadgets.
Yes.
So you can contact www.unitedlifeline.com. There's another one, a phillips.com/lifeline, northwelloncall.com, and there's another one, amac.com, for those medical alerts.
Yeah, and there's Life Alert, which is one of the more popular ones.
Okay.
Yeah. Yeah. A lot of resources. But it's difficult time for everyone involved. I remember feeling just so overwhelmed and trying to make sure that I was doing everything for him and for my mom, in the best way I could. But don't hesitate to ask for help because
Keep your eyes open for local resource guides for seniors. So there are a few publications that are out that you could pay, what, maybe, I don't know, $15, $20 for the year, and they come to your house every month. But there's also navigation guides that will give you resources of all different kinds of people and resources in your immediate area.
right.
So if you can locate one of those, that really can be powerful to have on your kitchen counter.
Mm-hmm.
That's for sure.
Mm-hmm. Yes.
Hmm.
Yes. Actually, they have, and I'll write it down too. It's a caregiver.org/fact sheets. And they have different fact sheets, including holding a family meeting, hiring in-home help, residential care options, making end-of-life decisions, what are your important papers, and understanding palliative and supportive care. So those are just fact sheets that they have. through this caregiver resource area.
Yes,
Yeah,
get them, print them
yeah,
out. I mean, these are important things. So the more help you can get, the better. Alzheimer's, alz.org, Alzheimer's Association,
yes.
alzheimers.gov, um, you know, Veterans Affair.
Mm-hmm.
You can go to caregiver.va.gov for
Nice.
some more information on there,
Yeah.
regarding your veterans. The
Yes.
Rosalind Carter Institute for Caregiving at rosalindcarter.org.
Nice.
And of course, there's many books that you can get, and even free resources. If you go to YouTube, go to YouTube. I go to YouTube all the
Mm-hmm.
time, and I put
Yes.
in the search anything that I'm looking for, and you bet these videos are going to pop up. And
Yeah.
I've learned so much. I'll be stuck on something about LinkedIn, or, I'm using Canva for something and you're stuck. You just ask the question in
Yes.
YouTube,
Yes.
and
It's
then this
great. It's
morning,
amazing.
my wonderful friend Lisa gifted me, probably about a year and a half ago, Miss Alexa, who's in my house. And oh, she
Uh-oh.
didn't talk. She didn't talk. But I had a random question. I forget what the question was. Uh, I forget what the question was. I think it had to do with nutrition or something. And I asked Alexa, and she told me.
Isn't that
She
great?
told me. Alexa is a resource,
She is.
people.
She is. Isn't that amazing? We use her
Anything
all
you
the
want to
time.
know.
We use her all the time. Oh, I forgot to
It's,
mention something about employee assistance programs. If you are employed, there are a lot of benefits in your workplace that you may not be aware of. So they vary depending upon obviously the size of the company and the benefits, but that's something that you really should know about and don't
go
hesitate
ask.
to ask.
I worked for a large corporate company for many years before I'm doing what I'm doing regarding end of life. And they're they're very private. People, they're personal and they keep your
Yes.
privacy intact.
Yes.
And you can go ask for this help, and programs are there for you, and you probably don't even know about it
Yes.
because that manual is in the bottom drawer underneath everything else
That's right.
that you
That's
got
right.
when you were first hired.
And that includes, by the way, paid or unpaid leave from your job. Okay. Because it may be available for caregivers through either federal, state, or employer provided programs. And people don't think about that as well. So that's a human resource department question to ask.
Yeah,
And the
yeah.
confidentiality. There are a lot of resources as we've,
Um, hmm,
yeah.
wellspouse.org. That's
Oh,
interesting.
uh-huh.
It shows you a network of support groups around the country, including the chapter on Long Island, but it offers emotional support for spousal caregivers and advocates, and for programs that deal with families with chronic illnesses.
Nice.
That's wellspouse.org.
Nice. Nice.
Caringforthecaregiver.org.
Mm, mm,
They offer weekly support groups. That may be in New York, though. I'm
uh-huh.
not too sure about that one.
Okay.
They have respite care services all over. They offer that through hospice and many other adult daycares and hospitals. And please, you can look into that. A lot of support, again, for dementia and Alzheimer groups and veterans. Again, it's just really researching and looking. I wish everybody had this book here that I'm looking at, um,
What's the name
which
of the book again?
my friend is now just publishing. It's called The Caregiving Navigator.
Nice.
So right now he will come out with a national version. This one is just about to be published. So if you're in New York or the tri-state area, you can go to Roel Resources, ROEL resources.com.
Nice.
He also has a podcast with people that come on and speak about seniors and aging and all the wonderful kinds of things that we need to know.
And
So
we've
you
been
can
on
check
that, you
out
and I.
we were
You and
on
I,
his show.
we were.
That's right. So you
Yeah.
can go and find Ron's. You can pre-order his Navigator as well. It's just unbelievable and beautiful, and the resources are just, they go on and on and on. And that's why it was really important for Lisa and I to do this show today, because most people just don't know. They're sitting in their house, and maybe the one person that comes into your house that week to visit knows of somebody that you can call for this or for that, but that's one person.
Yeah.
You don't know how resourceful they are in their
Circle.
resources. And they might
Yes.
be.
Yes.
They might be. I'm not saying they won't, but it's really up to us to do the
Yes.
legwork and the research that's needed.
It is. It is.
Right?
We have done a lot of resources, given a lot of URLs. Um, yeah, it's challenging. It's difficult. Um, but trying to pull it together and trying to get the help you need, that's the most important thing that you can do for your loved one and for you, you as a caregiver.
That's right. And just remember, if anything, we talked fast today, if anything was confusing, or if you need help to contact somebody or anything like that, our phone numbers are right above us today, and give a call. And if we don't know the information, we'll help you find it. But we
Yes,
really do appreciate you listening in today. And again, Lisa and I always welcome any suggestions. If you and your loved ones and your friends are going through a particular subject that maybe we can put together a video on, let us know.
yes,
Shoot us an email, and make a suggestion. We're always welcome to new ideas and thoughts.
we are. And I know we said a lot, and we will list in the article eventually when we post this, we will list all the URLs and all. So, you'll see them also
Wonderful.
on the listing. So, yeah,
And
thank
in your latest spare time, Lisa,
you.
I know a few of the things. There are too many to list today.
So
Let's
the
hear
only thing,
about one.
okay, so on May 31st, I will be offering an honoring parenthood workshop through Cope Foundation. I'm really looking forward to it. It will talk about how to remember our mothers, our fathers, people who were mother-like or father-like, and also our own grief over, the children who we perhaps have lost. So I'm looking forward to that workshop. It is a Zoom, and it will be advertised at the Cope Foundation. So, and you, I know you do a lot.
Wonderful. Looking forward to that, Lisa. Looking
Thank you.
forward to that.
Thank
So right now, if you go to susancaperso.com or Easton Doula Care, it'll take you to the same place. But I have a 4-week program for family members of people who are at the end of their life. So if you are the caregiver or you're at home with a loved one, this can be a frightening time. It can be frightening and overwhelming and draining, to say the least, when you know that in the next few months your loved one will pass. So I have a 4-week program. You'll see it on the site, where I work with you on a one-to-one basis, and that is over Zoom as well, because I've worked with people in many different countries and around the United States. But over 4 weeks, this will give you ample time to sit, talk with me, learn some tools and ideas to implement inside of your family. Um, from an end-of-life doula, these are some of the things that I do when I work for patients and their families.
you.
So you can
Nice.
take a look at that on the website.
Wonderful.
And we're looking forward to next week. I know you're going to be out of state for a few weeks, but we'll continue to post, and we look forward to you next time. And we forgot about the biggest resource of all, Lisa,
Which is?
our YouTube channel.
Yes, that's true. You're right. We've got
So
90 videos, everyone. I
we have
cannot
about 90
believe 90.
videos, and Lisa and I really, really feel in our hearts that every one of these are resources for you
Yes.
and your family on certain topics and particular niche topics that you won't always hear about. So go to the videos button, look at all the videos we share. If you have a friend that's going through this time of her life, before, during, or after a loss, perhaps there's something in there that will be helpful for them. And we do it out of pure passion
We do.
to help you who are listening today, right?
We do. We do. Yeah.
Remember to like and share our page, and we look forward to seeing you next week.
We do. Take care. Thanks so much for joining us.
Thank you.
Okay.
Bye.
Bye.